Welcome to Zoom In, Zoom Out, your global look at news from Taiwan. I'm Reece Ayers. HIV and AIDS cases have been falling in Taiwan. A recent Centers for Disease Control report shows a year-on-year decrease in the number of new cases. There were 941 new HIV cases last year, continuing a downward trend since 2017, and the lowest number in 2 decades. Health officials say better access to testing, treatment and preventative medication have brought the disease under control. Today, to dive deeper into the issue of sexual health in Taiwan, we're joined by one of the biggest names in HIV research and education, Dr. Stephane Ku, who's an attending physician of the Division of Infectious Diseases at the Taipei City Hospital Renai branch. Thanks for joining us, Stephane.
Thank you for having me.
First, let's zoom in on Taiwan and its efforts to bring HIV rates under control. As we just saw, recent reports indicate that rates continue to decline, with Taiwan CDC saying that HIV infection rates are essentially under control. Is this a cause for celebration, and how do we get to this point?
Well, I think we can celebrate a little bit because this is really the first time since 2017 that we see more than 60% decrease. It's not a single policy that caused this decrease. For example, we started Treat for All, that people are being tested and get treatment if they have been receiving diagnosis of HIV. If they want, they can get the treatment right away. And also we were promoting self-testing kits so people can test HIV by themselves at home. And also we do started government subsidized PrEP program, so making PrEP more available to everybody.
And part of the battle against HIV and AIDS is also tackling the stigma attached to it. Has there been progress in changing public perceptions towards the disease?
I think the answer would be yes and no. If you're looking at the survey recently, you will see that younger generations are more accepting, or they have proper knowledge on HIV itself. But also from some other polls and also surveys, we did see that the situation wasn't that perfect. For example, there was a poll aiming public generations back in 2020. More than half of the respondents said that they have negative opinions on people living with HIV still. And also there's another survey on people living with HIV from 2021. A quarter of these respondents reported they had this experience of being rejected by healthcare providers because of their status. So I think that while our society is keeping improving, we still have some way to go.
So is this decline in Taiwan unique to Taiwan, or are we seeing this trend in other places in the world as well?
I think for the whole world, if you look at the data from UNAIDS, it's actually decreasing. For example, Sub-Sahara used to be a very troubling pandemic area. Now we see the greatest decrease. Also, other countries in our region, for example, Thailand, Vietnam, Hong Kong, all see such decrease. I think for most of these countries, we have put efforts on this, so you do see the fruit. However, there are some areas in the world we do see an increase of HIV infection, new infections. For example, Eastern Europe and Central Asia, and also North Africa and Middle East. So these are the countries that usually have higher level of stigmatization, and also people were not, or the government not really putting efforts on this. So you will see the increase.
And in terms of contributions towards HIV research, has Taiwan made any specific contributions there?
In terms of all these innovation and clinical research, we did contribute a little bit. For example, there were monoclonal antibodies. It's kind of antibodies, artificially made antibodies for HIV treatment. So I think 2 monoclonal antibodies were invented in Taiwan. And also, Taiwan has been always a country with a higher prevalence of viral hepatitis. For example, hepatitis B, there used to be national health issues. So in the previous clinical research and studies, Taiwan had contributed a lot the study for people who had a co-infection of viral hepatitis and HIV. And also we adopted on-demand PrEP very early. So if the audience are being from US, they're always being recommended giving PrEP daily, but Taiwan has started recommendation on-demand PrEP very early.
On the subject of PrEP, I'm from the UK. In the UK, it's free and very easy to get, but in Taiwan, it still costs a decent price. Is that a barrier for some people who are looking to protect themselves against HIV?
So PrEP or pre-exposure prophylaxis is using an antiretroviral agent to prevent HIV. It's a very effective. It's good for all genders and all ages and people with a different category risk for getting HIV, and it's widely available and also recommended by WHO as part of the prevention tool. So it's widely available. So we all know PrEP works great if it's available to people who need it. I think Taiwan, we started this journey pretty early, like in 2016, 17, we started the very first pilot project. But in Taiwan, it's not covered by the National Health Insurance. So it's like 40% of people will get the PrEP from a CDC-funded program, but a lot of the rest of them will actually need to order them online or get that from abroad.
And finally, for the zoom in, what's the future looking like for HIV treatment and prevention? There's been talk of vaccines that are being developed and also preventative injections that you can take every 6 months or 2 years. Is there cause for optimism about the near future?
Of course, there's no vaccination available so far. So the current situation for HIV treatment and prevention would be like for people living with HIV, they just need to take 1 pill per day. So it's very easy. I always joke that treating HIV is even like easier than treating COVID or other chronic medical diseases. In the future, we are actually seeing people will get long-acting formulation for treatment and prevention. For example, for treatment, there are bi-monthly injectables that you had an intramuscular injection every 2 months, so that your HIV will be controlled perfectly. And for the prevention, as you mentioned, there will be 6 monthly injection for prevention.
Well, let's zoom out now and talk more generally about sexual health in Taiwan, and also the work that you've been doing with the LGBTQ+ community. So we've mentioned that HIV rates are on the decline, but there seems to be a rise in other sexually transmitted diseases and infections. What's the reason for that?
Well, if we look at the data provided by CDC, the sharp rise actually started from COVID period of time. It's not really unique to Taiwan. It's like universal everywhere in the world. So there are a lot of explanations. Well, of course, very obviously, people are not using condoms that frequently anymore. And then we do have some new screening tools for STIs. Nowadays we have PCR for STIs, so we can screen some asymptomatic infections. So in that case, we kind of found more new infections. But I think it's kind of important, we do see something about STI is that we have very good preventive tools for HIV. However, we don't have that many good tools for STI preventions.
Do you think that, medications, preventative treatments like PrEP, is that a double-edged sword? Is it giving people more confidence to explore their world sexually, perhaps less safely?
Well, I would say for human behaviors, it's It's something that's the most difficult thing to change. But from the experience of like in San Francisco or in London, they actually saw that even before PrEP was introduced, there were increase of STI infection already. It's not because people started to use PrEP and they become like less aware of HIV. It's usually the opposite, that they are aware of STI and HIV, so that's why they wanted to stop PrEP. So that serves a perfect tool for them, like a personal protection against HIV.
So you do a lot of work promoting sexual health education, particularly amongst the LGBTQ+ community. Are sexual health issues more prominent amongst the queer community? Why have you chosen to focus your education to that group?
Well, of course, there's a personal reason out of that. I'm a gay man, so I was born in 1980. That was the time when HIV was first documented in human history. So I think we have been kind of traumatized by the pandemic that's happening last century. Of course, nowadays we see HIV being a treatable, preventable disease, so it changed a lot. However, I think sexual health itself is not just important for LGBTQ community. I think it's important for everyone, and it's a taboo to talk about. And of course, for most of the LGBT community members, we first know that ourselves, like we kind of define our identity by knowing our gender and sexual orientation. And then of course, because you're different, you need to encounter, unfortunately, all this stigma and discrimination coming outside and inside the community.
And finally, what do you think is the biggest, or some of the challenges that Taiwan is facing in terms of sexual health and education?
It's a lot of challenges, to be honest. I should say, like in Asia, it's a big taboo to talk about. I found it's very particularly difficult to talk about it in schools. Like I think sex education for young adults and adolescents would be very, very important. But in Taiwan, that you didn't really talk about this until that you become grown ups. Of course, there are some other issues. Like I feel that making prevention like PrEP or STI screening more affordable to everyone is also very important. And of course, decriminalizing HIV transmission is also very important. So we still have so many issues to deal with so far.
Well, Stephane, thank you for joining us and thank you for the fantastic work you've been doing in the sexual health field.
Thank you for having me today.
This has been Zoom In, Zoom Out. You can find more stories from TaiwanPlus News by following us on social media. Thanks for joining us and we'll see you next time.
Enjoy the rich diversity of Taiwan's independent music. Taiwan Calling, every Sunday, 9:30 p.m. on TaiwanPlus.
For more stories from Taiwan and around the world, follow TaiwanPlus on social media.